All right. Well, hello, everyone. Thank you so much for joining us for this month's Kinetic Health webinar, where we are going to do a spotlight on men's health. For those of you who do not know, June is Men's Health Awareness Month, so we wanted to make sure we covered this subject as we think it's really important. My name is Jordyn Schwerin. I am one of the registered nurses here on staff at Apex Benefits. And then I am joined by two of my colleagues today that I wanted to invite and offer their insight on men's health as well. So this is Logan and Pat. I'll let them introduce themselves. Just say your name, what you do here at Apex, and then what you did for Father's Day, just for fun.
I'm Logan Weinzel. I'm a financial analyst, and for Father's Day, I went bowling with my kids for the first time.
Thanks.
I'm Patrick Kirchhoff. I'm a senior market analyst here at Apex. I've been here for almost 2.5 years, and for Father's Day, I was up in Canada for an annual fishing trip.
Nice. All right. Awesome. Well, thanks for being here, guys. Throughout the presentation today, as we go through different topics and subjects, I will be asking Pat and Logan some questions just for them to offer their insights, their experiences as we just get into this discussion. So to start off, just some webinar housekeeping. I know this is a big reminder for those of you who have joined us before, but all attendees will be in listen-only mode, meaning your mic will be muted. But if you have any questions or comments, we do have someone who is monitoring the chat throughout the duration of this webinar. And if we have time, we will get to some questions at the end. If not, we will also provide my email at the end so you can ask questions as well. Please ensure your speakers are on and adjust the volume accordingly. And lastly, today's presentation slides will be available to you. If you just go to the bottom right hand side, there's a paper icon that'll allow you to download this presentation if you would like to have that available to you. As far as our agenda for today, we're going to be talking about men's health. Why do we talk about it? What's the problem? And maybe where are we needing to discuss some different topics and bring more awareness to it. Preventative health, mental health, as well as signs and symptoms not to ignore. I wouldn't be doing my nurse due diligence if I didn't at least talk about that. And then lastly, sprinkled throughout the presentation, we will be talking to loved ones, partners, spouses, on some thoughts and ideas of how to encourage the male loved ones in your life to prioritize their health and take it seriously. Because I know you may be tuning in, but they may not be. So we want to make sure this presentation is helpful for you as well. So to start off, what is the problem? Why are we talking about men's health? According to a Cleveland Clinic survey in 2019, men will do almost anything to avoid going to the doctor. So this was about 5 years ago. And of course, there are always exceptions to surveys like this. We know not all men will avoid, but we see that the general population, a majority of men do avoid going to the doctor. 72% said that they would rather do household chores. 41% were told that as a kid, you don't talk about your health issues. You don't complain, essentially. So they were like, so I don't go to the doctor because I'm not a complainer. Lastly, about a fifth of men admit that when they do go to the doctor, they're not honest with what's going on. If they're noticing anything off, they don't want to bring it up. And there's a lot of different reasons for that we saw in this specific survey. A lot of men said they were embarrassed. They didn't want to bring something up. There was a decent amount that said they knew something was wrong, but they didn't want to face a diagnosis. And then lastly, a lot of them also didn't want to hear what they needed to change. So we see this as a prevalent issue with the men just currently in the US today. And so we wanted to make sure we discussed that. So to start off, we're going to get a discussion rolling with Logan and Pat. So Pat, I'm going to start with you here. What are some of the reasons that you think men avoid taking care of themselves?
That's a good question. I think that there is a mental health stigma, and there is also stigma around men talking about their issues,
Yeah.
and that you feel like there's a sense of vulnerability when you're admitting that there is a problem.
Yeah.
And I think that men avoid avoid going to the doctor because, they say life's too busy, I'll get around to it. They won't necessarily go to the doctor unless, there is a present issue that they can identify. And so, you, go to, you have lifeboats and you have, women and children first. I think about that, living my daily life, like I'm going to take care of my wife and my kids, but, your health is just as important, and, you need to be there for your family. So there's a little stigma around it.
Absolutely. Logan, do you agree?
I do, and I think a lot of the reasons are probably the same as women's reasons. Like Pat said, you only have so much time in a day, and you already have to parse and split that out so many ways. So you have a big chunk of that's work. You have chores that you have to do. If you're married or you have a girlfriend, there's that relationship you have to keep. If you have kids, and that's another relationship or two that you have to focus on. And so your time shrinks pretty quickly throughout the day. And I do think there's validity to people that have signs and symptoms are afraid to get the news that they might get.
Yeah, no, that's fair. But it sounds like sometimes it doesn't feel prioritized when you're trying to take care of your family or trying to take care of your loved ones, and you don't want to complain about anything going on with you. What made you guys want to start being proactive about your health? Logan, I'll start with you.
So I never got to meet my dad's parents. Both of them died very young from heart attacks. My dad was still in high school when his mom passed. And then around 2017, my dad also almost died of a heart attack. And so seeing the impact that it had on my dad losing his parents and having to go through young adulthood without parents while raising kids, and then seeing or feeling the impact that it had on me with my father who had a health scare, that's something I never wanted to put my wife and kids through. And so that's what really led it off. And then once I started doing it, I just started having fun doing it. So that's why it's such a big part.
Sure. Yeah. Pat?
Yeah. So, we have a family history of different cardiovascular issues, and I've lost some family members, grandparents, aunts and uncles very young. But also, I have 3 small kids at home. I want to make sure that I'm in tip-top shape so I can be around with them as long as I possibly can, be the best version of myself. And, even looking at my my parents and them being grandparents to my children, I want to make sure that I'm here for as long as my kids, to have kids, and, I want to be a grandparent as well. So that's really where I started being a little more proactive.
Sure. Yeah, absolutely. All of that really important, like making sure you're around to enjoy your loved ones and enjoy your kids' lives and have a good quality of life. I think that's all great. Starting out with any changes we know can be really difficult. And throughout this presentation, a lot of the topics we'll be discussing will be around different reasons to prioritize going to the doctor or getting screenings done. But I also want to make sure we start off with acknowledging the small changes you can be making to start prioritizing your health even as early as today. The list on this screen, these are just small changes that can add up over time, as we'll talk about with Pat and Logan here shortly. But on this slide, you can find different goals around physical health, emotional health, mental health, whatever you feel like may be lacking and you're not prioritizing in your life right now. These are just a couple very easy, simple ways to incorporate into your day-to-day life to just start taking care of yourself and prioritizing yourself so that you can bring your best self to your family, to your loved ones, and have a good quality of life. I want to turn it back over to you guys here. What steps do you take on a weekly, monthly, or yearly basis to stay healthy? Pat, I'll start with you.
Yeah, sure. So weekly, I have a cap of activity that I like to meet, steps I like to meet, sleep that I like to meet, which is hard with 3 kids at home. Now, monthly, the iPhones, they do have a health fitness tracker that kind of gives you trends and benchmarks to kind of show you where you are throughout the month. So steps, like I said. But for me, I have high blood pressure in my family, so I can look and see, how my physical activity is incorporated with my, heart rate and things like that. So I can see the trends on that. So I like to just keep tabs on that to see where I'm trending. And then yearly, I like to go to the doctor and get my labs done every year, just to see where my levels are. And then just make sure that everything's going the way it should be going.
Yeah, absolutely. Logan?
Yeah, so weekly, I like to try to ensure that I get at least 5 hours of physical exercise in a week. Monthly, I have a harder time setting goals monthly just because it's short, in my opinion, to try to track progress, unless you're looking at something like tracking the 5 hours every week for the month. Or if you're doing something cardio related and you're looking at distance or something like that. But yearly, what I like to do is somewhat of a New Year's resolutions where I'll set a really hard goal that I don't think I'll actually be able to reach, but I know I'll get reasonably close. So that way, throughout the year, it keeps me motivated, it keeps me chasing it. And then once you get to that October, November time frame, you have the major holidays coming up and you want to be lazy. Looking at how close I am really helps me finish out the year and finish it out harder to try to actually meet the goal.
Yeah, no, that's great. Those are great ways to prioritize it on different frequencies for sure. What advice would you guys give to someone who doesn't prioritize their mental or their physical health right now, Logan?
So when people ask for advice for getting into a healthier lifestyle, be it physical or mental, I always tell them the same two things. And the first thing is no one's going to make sure that you do it. Like I said earlier, you only have 24 hours in a day. You have to carve out time for yourself to start living healthier. And so I like to not eat lunch on my lunch break and I'll go and I'll exercise. Or if you want to focus on your mental health, instead of doing it for an hour or however long it is, if you just take 10 minutes or however long you want to set and pray, meditate, focus, sit in silence, something like that, which leads me into my next thing that I would tell people is be consistent. Just like no one's going to carve the time out for you, no one's going to hold you accountable for doing it. So you have to be your own source of accountability. If you go on lunch every day. If you pray or you meditate or whatever you do to start your lunch for your mental health, do it every day. Because these short-term changes, you don't see a long-term effect on them until you do them in a long-term sort of way.
Sure, yeah.
Yeah, I mean, to Logan's point, I mean, it's a marathon, it's not a sprint. So staying consistent is key. Whether, I like to check boxes, I'm very goal oriented. So whether it's getting outside, getting sunlight, it's getting your steps in, it's eating right, eating vegetables, eating just really identifying, some of those things that are, not necessarily going to change your life, in the matter of a day, but making sure that you're staying consistent, doing those things over time, because, with time, you're going to start to see results.
Yeah, and you're going to see that result, whether it's in your mental health, physical health, whatnot. All very good points. Diving into now, we talked about some of those daily things you can be doing, but what do we look at when we're looking at health? So preventative care is going to be one of those key ways to staying on top of your health and any other preventative care exams. In other presentations I've done before around the importance of preventative health, I like to say that my primary care provider is kind of like my healthcare quarterback. They're going to be the point person in my healthcare journey. They are going to know my personal history, my family's medical history, things that I'm more at risk for, so that they can advise certain screenings at different times. This is a person that you want to have a good open relationship with, that you feel like you've established trust, you can tell them what's going on and be honest. So we really want to prioritize encouraging you to get established with a primary care provider if you're not already. Unfortunately, on the screen, you can see that there are oftentimes wait times when it comes to getting a primary care provider, even up to 6 months. So what I really like to encourage people to do is, regardless of, time frame, just get something on the calendar. Pat and Logan already alluded to this, but sometimes when other priorities, when you're thinking about your family and trying to get your kids to appointments, your prioritizing of your health can fall at the wayside. But just getting something on the calendar can be really helpful with that. Personally, I found with my husband that was a really helpful way for us to prioritize our health, was just get something on the calendar and know I could cancel it, I could move it if I needed to, but having something there always increases the likelihood that we'll go, rather than just keep putting it off. After 2020, we did see a lot of late stage diagnoses, and we know that the later something is diagnosed, often the more complex and aggressive treatment plans can be. So the more that we avoid things that are obviously wrong in our bodies and we're not bringing them up to our doctors, usually oftentimes the worse the outcome is or the more difficult the treatment plan is. So that's why we really encourage you to go to the doctor, have those honest conversations so that hopefully we have a better prognosis and easier treatment plan in the long run. So with that, we do know that there's some preventative care that we encourage for men at a lot of different ages. So on this table, you can see, you can always take a picture of this if you would like, but it's divided by age brackets and then shows you what screenings or exams are encouraged for your specific age bracket. Now, I do want to acknowledge here, I know there are some screenings on this screen that men are typically not very excited about. But the reason these screenings are advised within these age ranges is because that any particular cancer or chronic condition are most often diagnosed within those age categories. So that's why you see them listed there on the screen in the 20s and 30s, in your 40s, because that's most often when it is diagnosed. And again, like we said before already, the earlier something is diagnosed, usually the less intense or aggressive a treatment plan is versus later on. So we want to make sure we're taking care of that on the earlier side. Another thing I do like to talk about here is that for men, as we start hitting 40s, 50s, and 60s, cardiovascular risk does tend to increase, unfortunately. So that's why you see that blood pressure, cholesterol, annual screenings become a little more common by the time we hit those age ranges, just because of that cardiovascular risk increasing. Again, we want to be catching things sooner rather than later. If we can avoid a heart attack by catching high blood pressure on the earlier side, that's what we would prefer. So that is why we encourage that within these age brackets. But with men's health, I do want to make sure we cover a really difficult subject, I think, when we're talking about it, mental health. Like Pat already mentioned, there is a stigma that maybe it's a little more manly to tough things out, to not talk about what's really bothering you. And unfortunately, that I think has really worn on the male population. Mental health overall, we see men are way less likely to receive treatment or diagnosis for anxiety or depression, but we see a much higher statistic where men commit more suicide than women. So we know that it's an issue that is not being discussed, and we want to make sure we bring light to that today. One of the things that we notice is that male depression is often underdiagnosed because males oftentimes show depression or anxiety in a lot of different ways than maybe women tend to. So men, we may see more anger, irritability, maybe we see disrupted sleep patterns that are out of the normal, or we might see them withdraw or try to just really stay busy and not talk about anything that's going on. So I wanted to make sure that we got Logan and Pat's thoughts on this because I think it's really important. So Pat, we'll start with you here. Why does mental health matter to you?
Well, it matters to me is because I just want to improve my quality of life, as best as I can. I want to be in the best place to deal with stressors or problems that come up in my life and be able to attack those head on. And I want to be the best version of myself for my wife and kids at home. As you mentioned, people show, anxiety and depression in different ways, and I'm guilty. I am someone who tends to bottle things up and not address some of those issues as they come up. And sometimes I forget, I know I'm in a bad mood, but I don't know why I'm in a bad mood.
Yeah.
And it's until I get home and, I see the way it's affecting, my communication with my kids, my wife. And then, so I found that it's better to just address those. Don't feel bad about, having some issues you might deal with mentally, because it's only going to help you in the long run.
Yeah, and I think everyone deals with them in some way. Logan?
Yeah, so to go back on something you mentioned earlier in the difference in warning signs is I do know several people who have committed suicide, and I found out a couple of years ago one of my roommates committed suicide, and I mean, there really wasn't much in the way of signs or warning signs, except he would go through cycles of pretty bad sleep cycles. And so just reach out to your friends, let them know that you care about them. But for me, it matters to me because I have a wife and kids that count on me. And when I go home, if my mental health is low or if I'm drained, then it affects the output that I give to them. So I'm not the level of a dad that I want to be for the father standard that I set, or I'm not the husband that my wife deserves and the standard that I set for myself. And so staying mentally healthy helps me to keep those standards and also helps me to provide the level of relationship that my wife and kids deserve from me.
Yeah. Well, and it's cool to hear how that's a motivation for both of you guys, is your loved ones, your families, because you want to be bringing your best self to them. So I think that's a great motivator. What steps do you take to keep your mental health in check, Logan?
Yes. So for me, my mental health it starts with my spiritual health. And so there's a few things that I do weekly, daily, that I make sure I try to hit. So every morning I try to wake up and read my Bible for an hour. I pray twice a day, once in the morning, once in the evening. And so that way it just helps me start and end my day with a gracious and thankful attitude. And hopefully the time periods between that can stay the same way. Get up and go to church on Sundays. Other than that, I have some pretty quiet hobbies. I like to hunt, I like to fish, I like to garden. And it's nice to get away from all the noise and craziness and be able to focus on one task and to just kind of process everything that's going on and to do it in some silence.
Yeah. What about you, Pat?
Yeah, so I mean, I always like to, make sure whatever I'm putting inside my body, is that I can identify what it is. Usually if I'm eating clean, I'm feeling better. I like to get some physical activity. I like to go to the gym. Logan and I go to the gym all the time. And we also like at home, we like to make sure that my wife and I are getting the chance to do things that we enjoy. So it's just not days of monotony where you're going to work, you're taking care of your kids, and you feel like you're just doing things, taking care of other people all the time. So my wife and I are really good at making sure that we're each doing things that we know we get enjoyment out of, whether that's going to Canada for 9 days, or my wife is very social, she likes to hang out with her friends, and so we're always keeping tabs on each other, making sure that we're taken care of. And so those are things we usually do for each other, to keep ourselves in check.
And that takes, communication of her knowing what you need, you knowing what she needs, and vice versa. So I think that's good to have someone that you're checking in on, and being aware of that. Lastly, for you guys, as we're talking about, primary care providers, specialists, therapists, whatever someone may need, what do you guys advise when someone's trying to find a provider that they can trust? Logan?
So I think right now we live in a world where every piece of information is at your fingertips. Local news stories are now national news stories, and it's really taken a hit to small communities and institutions, and enrollments across the board is down. So I would say get involved in your community, church, religious institution, Little League, Boy Scouts, whatever it is, and then build relationships. You're going to be more likely to accept the recommendation and the feedback of somebody who has an actual stake in your life than you would be to just Google and count stars on a review or to try to identify them on yourself. And so I would say get involved and have people you care about try to point these things out to you if there's something that's off your radar.
Yeah, for sure. And I think what you said, word of mouth is really powerful. So like talking to friends and loved ones of like, hey, I'm looking for, I've done this before, looking for a dentist. Who would you recommend? Because I have a fear of dentists. So, having someone that one of my friends recommended was very helpful. Pat, what about you?
Yeah, so obviously, like Logan said, is getting recommendations from your loved ones, and you can see how they may have helped someone close to you, and so, but also, as a guy, sometimes we keep things close to our vest, and we don't like to talk about what's on our mind all the time. And my recommendation is just to be as forthcoming as you possibly can when you're in front of a provider, whether it's a doctor or whether it's a therapist. They can't help you unless you're talking about everything that's going on in your life. And doctors ask questions, and sometimes guys will go to the doctor and they're like, why are they asking all these questions? That's personal. And it's like, they can't help you unless you answer honestly. And once you start doing that, that's how you can build the trust, because then you start to see the results and how they're helping you over time.
Yeah. So being willing to answer those hard, tough questions that they're asking you. I think that's really good advice. Like I said, I wouldn't be doing my nurse due diligence if I didn't at least talk about some signs and symptoms, specifically kind of catered more towards the male population, that we want to make sure you are not ignoring, because they really could be pointing to bigger problems in the long run. So starting off, abnormal findings on skin, any lumps, swelling, pain, redness, anywhere on your body, please make sure you're talking to your doctor about that. Again, it could be indicative of something bigger that's going on. So mentioning that to your doctor is always going to be better earlier rather than later. Loud snoring. If you are noticing maybe your spouse is waking you up a couple times a night and telling you to turn over because you're snoring pretty loudly, that might be something worthwhile bringing up to your doctor. Unfortunately, this can be a precursor to heart disease, diabetes, stroke. So again, talking to your doctor about that, where that cause could be coming from, is going to be really important for your conversations. Changes in urinary habits. I know this sounds a little TMI, but it is something that's important to discuss with your doctor. There's a couple symptoms on the screen that you can see that if you or a loved one is ever experiencing these, it's really important to speak with them, because it could indicate some issues with your prostate. And of course, that's something we want to make sure is taken care of sooner rather than later. And lastly, like we kind of already discussed, cardiovascular risk, it does increase quite a bit as men start to age into their 40s, 50s, and 60s. So being honest when you are experiencing any type of chest pain or the symptoms that I listed, even jaw pain that radiates down to your left arm, even shoulder blade pain, all of those can be indicative of a heart attack, not always. But a heart attack is one of the concerns that potentially threatens your life. So that's why when people go to the ER and they say, I'm having chest pain, they usually get pretty prioritized, because we want to make sure that that is not the issue that's going on. If chest pain is something you experience on a regular basis, definitely make sure you're talking to your doctor so they can be evaluating your blood pressure, your cholesterol, and all of those cardiovascular risk factors, to make sure that we're not missing something and maybe preventing a heart attack in the long run. In our handouts that you can access on the right-hand side of your screen, we do have an ER versus urgent care flyer that shows you what signs and symptoms to go to an ER for versus an urgent care. Just really helpful information, even just to have on the fridge, because we do get a lot of questions about this, so I wanted to make sure we included this in our presentation today. So these are our sources that we used for this presentation, but you can see that my email as well as our other nurses' email is available for you if you have questions or comments. But we'll check if there are any questions or comments right now. Josh, do we have anything?
Not so far.
Not so far? Okay, great. We'll wait just like another minute, see if anything comes in. If you guys have questions or comments, Josh will stop me if something comes through. But we are very grateful that you decided to spend your lunch break with us, and we will see you next month on July 23rd, where we will have Guardian discussing different ancillary benefits and lines of coverage to consider, and we'll be discussing that for our July webinar. And that is all we have for you guys today. Thank you so much for joining us. Thank you, Pat. Thank you, Logan. And we will see you next time.